Welcome to the community. Today we are going to talk about generalized anxiety disorder, or GAD. It is defined as a anxiety disorder that is an excessive or exaggerated anxiety and worry about everyday life events, and they always expect disaster or something bad to happen. Some of the most common things that they worry about is health, money, family, work, or school. School's an important one. We're going to circle around to school here in a couple minutes. Some of the causes are genetics, and with genetics I am going to mix that with learned behavior, because our children, they learn from us, and if a parent has GAD and their child sees them worry nonstop every day, they'll pick up on that, and it can be a learned behavior, and they can probably most likely start worrying about things going on in their life also. Some of the other causes are brain chemistry, chemical imbalances, and environmental factors such as trauma or death of a loved one, divorce, or pretty much any major life change can bring on GAD. Now, to be diagnosed with it, because just because you worry don't mean that you have GAD. To be able to get diagnosed with it, the first thing that you have to do is go and talk to your regular doctor, because it's anxiety, and you're going to have to get tests done to rule out other physical illnesses that have the same symptoms as anxiety, to make sure that there ain't something physically wrong with you. Once you get those tests done, they'll most likely recommend a psychologist or a psychiatrist to do a evaluation, and you're going to have anxiety symptoms that are caused by excessive worrying, and you have to have those symptoms more days than not for 6 months or more to actually be diagnosed with GAD. It is a progressive disorder, and like I said earlier, I was going to circle around school. It does happen a lot in children at younger ages, and you need to keep an eye on it, because if they're showing these symptoms, the older they get, the worse it's going to get, and the harder it is to treat, because, well, we'll get into treatments here in a minute, but it's certain things that you have to watch out for. Is like, even if your kid's doing really, really good in school, but they're going over their homework over and over and over again, they're obsessed with it, even though that they know it's right, they're going to keep going over it. And then when test day comes up, they might feel sick or like overworked, where like they really don't want to go to school because they're so stressed out, and then they take the test and then they get a B or a C on the test, and then it's like the end of the world to them, because they're like, I studied so hard, I knew all this information, why did I get a bad grade? Well, it's because they were so worried about it and their anxiety took over, that they were so stressed out, and they had so much anxiety that they weren't able to focus on the questions on the test. They're too worried about what the end result of the test was. So if your kids are having problems with that, it's really important to get them to a doctor and get them evaluated, and most likely they'll be able to get away with just going to a counselor, where they're able to work on coping skills on how to handle situations like that. Now, if they don't get any kind of treatment, it's progressive. So as they get older and they get a job, well, now they're going to worry about their job. And then they're going to have a family, and then they're going to worry about their kids, their spouse, and they're going to start worrying about their bills. And eventually it just gets so bad that they're not able to function properly on a day-to-day basis without this high excessive anxiety that don't need to be there. And it's going to be harder to train. They're going to have to retrain their brain. They're going to have to go see a psychologist to be able to retrain their brain to recognize the symptoms of the anxiety when they're coming on, so that they're able. It's called cognitive behavioral therapy, and cognitive behavioral therapy, it trains you to recognize the symptoms and to change the thought patterns and the behaviors of the way that you interact with that anxiety. And it's hard to do when you've been doing it for a prolonged period of time, having these anxieties, and you've never had a treatment plan. It can be pretty hard to deal with this, but there is treatment, and you can fix this. So, like, if you're like suffering with this, or you know someone that is suffering with it, there is hope out there. You are able to reprogram your brain to be able to handle stuff like this. It just takes time and patience, and when you start the treatment plan, follow through with it and use those coping skills that you're going to learn so that you're able to calm down and refocus and not worry so much. And then another treatment is medication. Now, there is no real medication that's going to fix it. There's no real cure for GAD other than the therapy to retrain your brain. But the medication, it really can help a lot with the symptoms of the anxiety. Because if you've seen my other videos about panic attacks, GAD, that's a symptom. You can start having panic attacks. And medication will help so that they're not as severe, and it can help you on a day-to-day basis as you're going through your therapy. Once you do enough therapy and you're using those coping skills, you'll most likely be able to get away from the medication. So you're not going to have to be on medication for the rest of your life if you go get the right kind of help. And then there are other things that you do at home remedies, such as exercising. You'll be absolutely amazed on how a proper diet is going to help anyone with any kind of mental disorder, because that has a lot to do with the chemical imbalances. If you're living on macaroni and cheese and hot dogs, you're not getting the right nutrition, and you're going to develop some issues. You need a good diet. Sleeping properly. Sleep can be difficult too, especially with this kind of disorder, because you're going to worry so much that you're not going to be able to sleep. You're not going to be able to relax your mind enough to be able to slow down and be able to sleep. So you might want to melatonin, or talk to your doctor. Most likely the doctor's going to tell you to take melatonin, and that'll help you sleep properly. And then things to stay away from is caffeine. A lot of caffeine is really not good for you. Of course, alcohol and drugs. Everyone says alcohol and drugs are the devil, but they can throw off the chemicals inside your body, and they really can make your life more difficult than what it needs to be. So I think I'm going to wrap this one up. In a nutshell, it is obsessive worrying, and if you think that you may have this problem, you're not alone. If you see people that are suffering with this, there is help out there. They just need to go and get it. And with that said, I'm going to let you go and hope that you're doing good. Take care. Goodbye.